Now, the number of newborns being infected with HIV in the country has increased from 7.3 to 9.3%, despite efforts made to reduce mother-to-child HIV transmission. This is according to a new report by the National AIDS STI Control Program and UNAIDS, which revealed that babies acquire the virus during breastfeeding. As Noel Nabiso reports, early infant diagnosis and treatment also still remains low.
Nelly Pato, who leads the prevention of mother-to-child transmission of HIV at Nurse Hope, said a number of mothers infect their babies because they do not receive ARVs during pregnancy, and some drop on treatment, risking infection to their babies.
The thing with children is they depend on their mothers, not really mothers, but their guardians, because some of them are actually being taken care of. The guardians are not their mothers per se or their parent. If a mother is affected, she herself is not taking medication, will she be able to give treatment to her infant? Maybe not.
She added that a number of women also get to know their HIV status during antenatal clinics, an issue that highly risks infection of the newborns.
Proper follow-up is done, viral loads are done as per the guidelines. Infant prophylaxis is offered as well, and the early infant diagnosis is also done.
Peter Hamisi, the General Secretary for Private Health Facilities, echoed the need for greater inclusion of the private sector in national HIV strategies. He says that private hospitals have not been laying emphasis on treatment, testing and follow-ups to pregnant mothers who are HIV because they are money-making entities.
So the issue around follow-up is not really there. And you know, antenatal care is a very, very critical stage with a mother after she delivers.
Also present during public-private partnership commitment was Dr. Patrick Oyaro, Chief of Party LVCT Health, who noted that mother-to-child transmission remains a significant challenge.
We have been able to support this aspect of the program through HIV testing. So we support the counties to be able to make sure that any pregnant or breastfeeding woman who comes to the health facility is tested.
According to the report, 1,326,336 people are living with HIV. It shows that HIV infections increased from 16,000 in 2023 to 19,991 in 2024. On the deaths reported, 2,685 were children aged 0 and 14, while those of the same age who got infected with the virus were 62,798. Children are documented to have low treatment coverage at only 75%, despite high infections and deaths, with their viral suppression being at 66%. As the country gears to fight against mother-to-child HIV infection, it's clear that private hospital now bears the largest burden because they have the largest number of HIV infections. Reporting for KTN, I'm Noel Nabiso.
Thank you, Noel, for that.